We all know that access to a screening is not universal. It's not only suboptimal in the general population, but it's screening is less accessed by patients who are from racial ethnic minorities, patients who have different kind of insurance, such as state-funded insurance, Medicaid, and also patients who are living in poorer neighborhoods. The question we asked is that if we look at the patients who are diagnosed with colorectal cancer, is there a differential in use of emergency room in this patient population? With the notion that can emergency room be looked at as an anchor or a trigger for initiating the process of a screening. So we looked at the patients in the California Cancer Registry between 2010 and 2015 who had the diagnosis of colorectal cancer. We looked back 2009 through 2016 at emergency room visits by linking the California Cancer Registry to healthcare administrative records. Out of 66,000 patients with colorectal cancer, 58,000 of them were identified through this linkage. Interestingly, 60% of the patients had emergency room visits, but more interestingly, 40% of them had emergency room visit prior to the diagnosis of colon cancer. Now, the reason for emergency room visit was different, anything from maybe a car accident, trauma, to issues related to the GI, such as abdominal pain, nausea, vomiting, bleeding. But what stood out is that there was a disparity by socioeconomic status, by race, by insurance status, and by age among patients who had emergency room visits prior to their diagnosis of colorectal cancer. In fact, all of the areas of disparities that we found are exactly the population that have lower access to colorectal cancer screening through our routine screening strategies. And so we found that as potentially an opportunity to identify patients who have emergency room visit and put them through a specialized program to facilitate a screening in this patient population who may not go through other routine paths of screening, such as seeing their primary care physician or other means for being screened.